Today we're going to be talking about eye health, and we have a very special guest, Dr. Luisa Prieto from Union Square Eye Care in Harlem.
I'm Dr. Luisa Prieto, one of the optometrists at Union Square Eye Care in Harlem. And today I just wanted to speak to you guys about vision and overall eye health and present some of the most common conditions we see in practice. First of all, I wanted to start off by speaking about vision in general. Why most people come in is because they're having trouble seeing. And there's different types of what we call refractive error. You could be either myopic, which means you're nearsighted, hyperopic, which means you're farsighted, presbyopic, and then there's astigmatism, and we'll go over all of these shortly. Here we see a picture of a waterfall and a rock and some leaves. The first picture over here is how we want everybody to see what we consider quote unquote perfect vision. If you're myopic, things far away are a little bit blurry. As you could see over here, the waterfall is a little bit blurrier. And if you're hyperopic, things up close are a little bit blurrier. As you could see, the rock and the leaves are a little bit out of focus. All of these things, including astigmatism, which has to do with the shape of the cornea, the clear part of the eye, can be corrected with glasses. The other thing that we can experience is called presbyopia. And this happens as we age, unfortunately. Around our 40s, we start losing our focusing power. So we need a little bit of help for reading. And that's why most people end up either with reading glasses. But if you're myopic or hyperopic, then you need either like a bifocal or a progressive lens. So overall, we're going to be speaking about conditions starting from the front of the eye. So eyelid, the white part of the eye called the sclera, and then we'll move back into what we call the posterior pole and inside of the eye and the retina. A lot of the common things we see is dry eye. And that presents with like a gritty, sandy sensation in your eye. You might also be tearing a lot, sometimes a little bit of itchiness. You just feel like there's something constantly in your eye. And the way we test for this is by putting a yellow dye in the eye because it will highlight any dryness. The cornea, the clear part of the eye, is essentially like the skin. And sometimes, especially like in the winter, just how our skin might get like a little ashy and like itchy. Same thing could happen in the eye, and that's what we see in that bottom right picture where it says grade 3 severe. That's a lot of dryness. Ideally, what we want to see when we put that yellow dye is grade 0 on the top left. So how we treat this usually is just like with our skin, how we put moisturizing lotion every day. We try to use, starting off with artificial tears twice a day to keep the eye lubricated. There are other things we could do if the artificial tears is not enough, but dry eye is something that's very personalized, but we always start off with artificial tears. It's actually a multifactorial. There's a lot of things. One of the most common ones is your tears evaporate really fast. The other one is that you're not producing enough tears. When that happens, the eye sends a signal to the brain to produce more tears to kind of like compensate, but then the brain sends like an oversupply of tears, and that's why, even though it's counterintuitive, most people with dry eye experience a lot of tearing. And then there's also environmental factors. So like in the summer, if you're in front of the fan, like in an area with a lot of AC, your tears tend to evaporate faster. And same thing in the winter with the heater. Moving on to the lid. So on the top picture, we see what's called anterior blepharitis. That's kind of like similar to like dandruff that sometimes we get on our head. We could get it on our lashes as well. And that also causes dryness because that will fall into the eye and basically disrupt the tear film. And I know this is a little bit gross, but there are some parasites called Demodex that are normal. We all have them on our skin, but sometimes they love going to the lashes and like proliferating there. And so they cause a lot of itchiness and a lot of these dry eye symptoms as well. Then on the bottom picture, we see what's called posterior blepharitis. On our lid margins, we have glands that are responsible for secreting the lubrication of the eye. But if you have posterior blepharitis, they become a little bit clogged, kind of like little pimples that you're seeing here, like on the lid. And that could also lead to a lot of issues. When posterior blepharitis gets very out of control, some inflammation and a small infection can occur in one of those lid margins and form what's called a sty. We see these a lot. They tend to be very, very painful at first and cause a lot of swelling on the eye. The main form of treatment is really by using hot compresses because the heat will help open up that gland and secrete all kind of like that gunk that forms inside. But sometimes patients don't realize that that's really what's needed and they kind of just let it run the course. But what happens is all that fluid inside kind of hardens into like a cheesy material and then it becomes like a permanent bump. So you may need like a small injection or a small incision to remove it. But please, if you get these, don't let it get to that point. I always tell patients, if you have eggs at home, boil an egg because it retains the heat. And then you could do massages like up and down over that sty. And usually that will help kind of pop it. This is also something we see very commonly. It's called the pterygium. It's basically an overgrowth of the white part of the eye. It's pretty much benign, but it just could be very bothersome to patients. One, appearance, it kind of bothers them. Or two, it can become very irritated. If irritation is just a problem, we treat it with artificial tears or an anti-inflammatory drop. But if the pterygium keeps growing, as you could see kind of like in this picture, it's heading towards the pupil, it can affect the vision. And then at that point, surgery is recommended because if not, it'll really start to bother the vision. These are formed really due to exposure to sunlight. Another name for these is called surfer's eye because surfers spend so much time in the sun, they start to develop these. But we do tend to see these a lot, not to the point where it's affecting the vision, but more like irritation. So wear your sunglasses. Okay, so moving on to like the middle portion of the eye, we think about the eye as like a camera. There's a lens inside. And as you could see on the top picture, it's pointing to our normal lens. When we're born, it's nice and clear. It's actually called the crystalline lens because it's crystal clear essentially in most people. As we get older, due to exposure to sunlight, diet, that lens begins to get a little cloudy, kind of like a little brownish, yellowish. It can affect your vision. This is essentially what a cataract is. Unfortunately, we all live long enough, we will develop cataracts, all of us, but not everyone will be affected. Not everyone will be bothered by them. Some people's vision will not be affected. But if it is, the only way to correct it is with a cataract surgery, which is nowadays a very simple procedure. And what they do is they remove that cloudy lens and they put a clear artificial one with your measurements so that you could see better. Moving on back to the back of the eye, which is called the retina. Diabetes is a big one, and hypertension, high blood pressure that can affect the blood vessels in the back of the eye. So on the left, we see a normal retina. We see nice and healthy blood vessels. When you have diabetes, these blood vessels kind of become a little weak and they can leak. And so what we end up seeing is a lot of blood in the retina, as you could see in the picture on the right. And then the yellow streaks is a lot of like almost like cholesterol fat deposits as well, leaking from the blood vessels. Diabetes is actually the leading cause of blindness in the United States because of this bleeding in the eye. If it's not controlled, the bleeding can eventually cause a retinal detachment, and that's very, very serious. So again, same thing with high blood pressure. If it's not well controlled, you will get similar signs with a lot of bleeding in the eye. The blood circulation eventually gets blocked and it can cause a mini stroke in the eye. So diabetes and high blood pressure, very, very important to keep under well control. The second leading cause of blindness in the United States is actually glaucoma. And glaucoma is a condition of the optic nerve, which is basically the cable that connects the eye to the brain and transmits the visual information. So most people don't realize that they have glaucoma, one, because it's painless, and two, you really don't start to notice the symptoms until it's very, very advanced. And what starts to happen is you start to lose your peripheral vision, your side vision. So as you could see in these pictures, the top left is what we want everybody to see, normal vision. And then as we move on to the next picture, you see early glaucoma, you kind of get a little like clouding clouding off to the side. And then with more advanced glaucoma, that clouding begins to impact your central vision. And then at end stage glaucoma, you have just a small little island of vision remaining, and you really don't want to get to that point. Glaucoma is associated with high pressure in the eye, not always, but it's usually that pressure damages the optic nerve essentially. Unfortunately, there's no cure for glaucoma, but if it's caught early enough, we could prevent progression with drops in the eye. If it's advanced glaucoma or end stage glaucoma, there is surgery, but you really don't want to let it get to that point. At our practice, we focus a lot on preventative medicine. So there's a lot of studies being done on glaucoma because there is also different types of glaucoma. The main type is primary open glaucoma, and that tends to be more hereditary. So really the main thing you could do is just get an eye exam just to make sure you don't have any of the high risk factors. So meaning family history or that the pressure in the eye is high, because it could monitor you and we could prevent it to get to that stage. The only other thing is like if you do yoga, don't do a lot of like headstands because that will increase the pressure in the eye.
Oh, how funny. That's interesting.
Yeah, but other than that, it's nothing, unfortunately, that you're doing wrong. It's kind of like you're almost predisposed to it.
Why do you still need glasses after having cataract surgery?
It depends actually what kind of artificial lens that they put in your eye. Technology has advanced a lot. So the most common type of lens that gets put is just to improve your distance vision, but you still need a little help for reading. So you end up needing reading glasses. You do also have the option of getting what we call a multifocal artificial lens in the eye. So if you get those placed, ideally you don't need glasses, but most of the time, most people end up just needing glasses for reading. So glaucoma usually affects patients above the age of 55. But if you do have a family history, anytime, around your 40s, you should start getting an eye exam just to get all the baseline testing. So basically, we check the tissue around the optic nerve, and we also perform what's called the visual field, which checks your peripheral vision. With glaucoma, it's a very slow progressing disease. So it's not something, if you are going to get glaucoma, you're not going to lose vision in 1 to 2 years. But if you let yourself go for more than that, it can really advance to the end stage. So, if we have the baseline information and we perform all these tests yearly, then we have something to compare. And the minute we see any change, then we start treatment. So there is another type of glaucoma called chronic angle closure glaucoma, and that usually presents with acute. So it's a little complicated, but basically it has to do more with the anatomy of the eye. If your eye is smaller than the average size, kind of all the structures inside are kind of clumped in, very close in space. There's a structure in the eye called the angle, and the angle is responsible for maintaining the pressure in the eye by secreting the fluid. But acute angle glaucoma, that angle is very narrow and it could close. So the drainage, the liquid has nowhere to go. So the pressure all of a sudden shoots up. Like normally the pressure in the eye should be anywhere between 11 and 24 points. That's what we call normal. But in acute angle glaucoma, the pressure shoots up to like 60 or 70 points. So the eye cannot sustain that pressure, and it causes a lot of damage in that one episode, unfortunately. That's not as common. It is seen, unfortunately.
Eye twitching. What is that all about?
So that's actually common. I get it too. It's very annoying. The nerve that controls the lid, the upper eyelid, sometimes goes into like a spasm. It can be due to a high stress, drinking a lot of caffeine, or not sleeping well. It will go away on its own. There's no treatment for it, unfortunately, but you should watch out for any other twitching. So any facial twitching, any lip twitching. If it's something that becomes bilateral, then you should definitely see a neurologist because it'll become more of a neurological problem. But if it's only the lid here and there, there's not much that can be done. I mean, some people say like if you drink tonic water, it might help, but there's no evidence-based medicine on that. Floaters. The eye is actually usually filled with jelly. That's what gives it its round shape essentially. And when we're born, it's nice and thick like jello. But as we age, it begins to disintegrate. So what you're seeing when you see floaters is that jelly, the strands of that jelly kind of moving back and forth. They're very annoying and they're very scary at first. When I first saw one, I thought it was a mosquito and I was trying to kill it. That's another thing that unfortunately there's not much that can be done for it. The brain will learn to ignore it, or gravity will help it settle down into the eye. But whenever you make any sudden movement, they kind of like pop into view. So again, those are normal. What's not normal is if you start to see any flashes of light, like a little lightning bolt or a bright flash, like from a camera, that can indicate a problem with the retina. The retina does not have any pain receptors, only light receptors. So it's the only way your body has of notifying you that something's wrong. So if you see a very quick light that won't go away, definitely let us know or go to New York Eye and Ear Infirmary because it could indicate the start of a retinal detachment, which is very, very serious. So healthy vision really starts with us. It's very important to eat right to protect your sight. So again, leafy green vegetables. I know while I was growing up, my mom said carrots. It's not bad to eat carrots. It's definitely good. It has beta carotene, which the retina needs. But really, it's the leafy green vegetables that contain lutein and zeaxanthin, which is the main nutrients for the retina. Also very important to wear sunglasses. Just how the ultraviolet rays aren't good for our skin, same thing for the eye, mostly for cataracts. Do not smoke because the smoke in general breaks down at a cellular level. It makes the cataracts progress faster, and then for the retina as well, it's not healthy. And then nowadays, since we have so much screen time, keeping in mind the 2020 rule, which is when you're looking at a screen or a cell phone or even just reading a book, every 20 minutes, look at something far away, at least 20 feet away or just out the window for 20 seconds. So short, frequent breaks is what's needed.
So you're going from a really sort of close focus to far.
You're relaxing your focus. Yes,
Gotcha.
that's a great point. Because when we're looking at things up close, we're using our focusing power. And if we don't take those breaks, then just like any other muscle, it's kind of like the muscle gets locked in. And then when you look at something far away, you can't relax that focus if you're not taking these breaks. So you want to help relax that focus by looking at something far, far away. The blue light glasses are very popular nowadays. Studies do not show that it makes a difference. I mean, it's more like a placebo effect. Some patients swear by them. It doesn't hurt to get them. It can help in terms of like sleeping patterns, like not affecting your sleep, which by the way, we shouldn't be looking at our phones or computer screens at least 1 hour before sleeping, which I know is also a big problem because we kind of go to sleep with our phones in our hands sometimes, or at least I do. But it's not something that you absolutely need, but it doesn't hurt. Really, the most important thing that you could do is really get an eye exam at least once a year with the dilation. I know it's annoying, but those are those drops that make your pupil big so that we could take a look at the back of the eye and really assess everything, cataracts, glaucoma. Those drops do make you a little bit blurry. That's why most patients don't like getting them. So you'll be blurry for about 2 to 3 hours. But if everything's good the first time you get it done, you likely won't need to get it done for another 2 years or so. But again, preventative medicine is better than actually, ending up with something more serious and getting treatment for that. There's so much because the eye is such a tiny organ, but really so much can go wrong with it. And so many systemic signs can present in the eye, such as diabetes and high blood pressure. So very important if you have those conditions, please keep them under well control.